Hello, my name is Jena Schmitz. I'm a nurse practitioner at Moffitt Cancer Center in the Bone Marrow Transplant and Cellular Immunotherapy Department. We're here at ASH in San Diego presenting Letermovir prophylaxis on reducing the risk of cytomegalovirus infection in patients undergoing HLA-matched and mismatched allogeneic hematopoietic cell transplant with the use of post-transplant cyclophosphamide. So we know that CMV infection is common in the allogeneic transplant patients. Risk factors including CMV serostatus positive, patients receiving T-cell depleting therapy for graft versus host disease prophylaxis, and patients that are undergoing HLA mismatched donors. We also have been using post-transplant cyclophosphamide as a standard regimen for graft versus host disease, with the known fact that post-transplant cyclophosphamide has a higher risk of superimposed viral infections and slower immune reconstitution. With all of this, we know that the use of Letermovir in patients receiving PTCY is not widely reported. So we evaluated 331 adult patients undergoing allogeneic transplant at Moffitt Cancer Center between 2014 and 2022. The primary endpoint was clinically significant CMV infection defined as CMV viremia with a CMV PCR less than 650 international units or symptomatic CMV disease. The patient groups were split amongst 3 groups by CMV serostatus. We have CMV negative patients, CMV positive no Letermovir patients, and CMV positive Letermovir patients. Table 1 is the baseline characteristics. And the figure over here, you can see that the cumulative incidence of clinically significant CMV infection for CMV positive patients without Letermovir, the cumulative incidence was 45% compared to CMV positive Letermovir patients, which was 11%, and CMV negative patients was 7.4%. There was no association between Letermovir and recipient CMV serostatus on graft versus host disease, neutrophil engraftment, or 1-year overall survival, non-relapse mortality, relapse-free survival, and relapse. This is table 2. The biggest thing you can look at here is that the CMV organ disease occurred in 18 patients. 2 of them were CMV positive Letermovir patients, and there were no patients that experienced grade 4 organ disease. So we can see, based on this information, that Letermovir prophylaxis significantly reduced clinically significant CMV patient infection in this patient group and can hopefully help to address a major limitation from this platform. Thank you.